Madison Phillips is a 20-year-old female seeking care today for dysuria beginning 1 week ago, shortly after the end of her period. She states that it has not improved with increase in fluid with the use of cranberry products, and has improved slightly with ibuprofen 400 milligrams twice a day. She reports associated symptoms of dyspareunia and increase in pain with exercise. She denies any radiating pain. The pain is a burning sensation. She rates this pain anywhere from a 3 to a 7 out of 10, and she has reported a previous urinary tract infection that had similar symptoms. In terms of history, Ms. Phillips is a sexually active 20-year-old with 3 prior partners. She takes birth control regularly and uses condoms occasionally. She has 1 current sexual partner, all of which were male. And she has had the HPV series in the past. She does not use any injectable or recreational drugs. She has no familial history of endometriosis or breast or uterine cancer. She, on examination today, her vital signs are within normal limits, and she does not have any abnormal changes to her external genitalia, and she does have some yellow cervical drainage with cervical motion tenderness. Her lower abdomen is tender to palpation in the bilateral lower quadrants, and she has palpable tenderness to her uterus and bilateral adnexi. So with these findings, I think it's concerning for pelvic inflammatory disease, given her age, her sexual activity, and sexual practices, as well as her physical findings and symptoms of dysuria, dyspareunia, the pain associated with coming on after her period, the cervical motion tenderness, the cervical discharge, and her physical findings of tenderness on palpation of her lower abdomen and reproductive organs. For further treatment, I would like to give her test the cervical fluid culture and wet mount, as well as run a UA and pregnancy test to rule out ectopic pregnancy. Pending the pregnancy test, I'd like to start treatment for PID, and with 250 milligrams of IM ceftriaxone here, and then prescribe her doxycycline 100 milligrams twice daily to go home with. The differential here would be urinary tract infection, appendicitis, vaginitis, and cystitis. For further assessment, education, we would educate her on PID, the course and treatment, on abstinence from sexual activity until treated, on safe sex practices, and on having her partner tested, or any partner that she's had in the last 6 months. And on follow-up, have her come back into the clinic in 72 hours to test for therapy effectiveness, and then have her come back in at the end of her treatment.